and I will talk about my research assessment of outcomes associated with needling point location used in sham acupuncture for pain conditions. In randomized controlled trials evaluating the efficacy of acupuncture, it is very important to set up a physiologically inert placebo control. However, as you heard in previous presentations, there are multiple factors inducing the therapeutic effects of acupuncture, such as acupuncture point, needle manipulation, needle retention time, needle skin penetration, and patient-doctor psychological interactions. Therefore, many questions have been raised as to whether an appropriate inert placebo acupuncture that can control all these factors is possible. In acupuncture efficacy trials, sham acupuncture has been used as a control intervention, and the techniques of sham acupuncture like 듣기, needling depth, and skin penetration are usually different from barium acupuncture, like using shallow needling or sham acupuncture device such as Straightburger device, Baksham device, and Takakura device, although they have not been proven to be physiologically inert placebos. However, in acupuncture efficacy trials, the sham procedure is sometimes conducted at the same acupuncture point used for barium acupuncture group, even though the evidence from brain imaging and biological studies has indicated acupuncture point specificity. In this case, although sham acupuncture produces less stimulation with shallow needling or sham acupuncture device, an effect due to acupuncture point specificity cannot be ruled out. Therefore, the use of these non-inert sham acupuncture controls can risk underestimating the outcome of acupuncture. Especially although many trials have assessed the use of acupuncture for pain conditions, its efficacy remains controversial, especially due to inconsistent effect difference between acupuncture and sham acupuncture. Therefore, recent guidelines do not provide consistent results regarding the recommendations of acupuncture for pain conditions. This is an example of acupuncture recommendation for the treatment of knee osteoarthritis. As you can see in the left side, according to the AHRQ guidelines, acupuncture has no evidence for the treatment of knee osteoarthritis. And however, acupuncture is conditionally recommended in American College of Rheumatology Arthritis Foundation guideline. In case of chronic low back pain, according to a recent paper, the recommendations for acupuncture were inconsistent in a total of 8 guidelines. Therefore, we hypothesized that sham acupuncture might produce different results depending on whether it is conducted at the same acupuncture point as those in the acupuncture group, or at non-indicated sham points for representative pain conditions. As far as we know, there were no direct comparative clinical trials comparing sham acupuncture at barium point and sham acupuncture at sham point. Therefore, we adopted a network meta-analysis as a research design, which enables an indirect comparison of effect size without direct comparative clinical trials. And we conducted a frequentist network meta-analysis using Stata software. These are our eligibility criteria of our studies. As for the type of population, chronic non-specific low back pain, knee osteoarthritis, and cancer-related pain were analyzed. Because of clinical heterogeneity and transitivity, 3 pain conditions were analyzed separately. And also, as types of intervention and comparator, barium acupuncture, sham acupuncture at barium point, and sham acupuncture at sham point were included. We only included manual acupuncture for comparison. And also, a waitlist control was included as a reference comparator. As for the type of outcome measure, we analyzed pain severity, and as for the study design, we included prospective randomized controlled trials. This is the first result. For chronic non-specific low back pain, a total of 10 studies were included in the network meta-analysis. A 4-node network map consisting of barium acupuncture, sham acupuncture at sham point, sham acupuncture at barium point, and range list control was generated. In the network map, the size of node indicates the number of participants in the intervention, and the thickness of line between the intervention indicates the number of direct comparative trials between them. As you can see in the middle of the interval plot, there were no differences between acupuncture and sham acupuncture at barium points. However, acupuncture was significantly associated with improvements than sham acupuncture at sham points. Furthermore, sham acupuncture at barium points was significantly associated with better outcomes compared with sham acupuncture at sham points. This result was recently published in JAMA Network Open. And for knee osteoarthritis, a total of 10 studies were included in the analysis. And as you can see in the middle of the interval plot, there were no differences between acupuncture and sham acupuncture at barium point. And however, acupuncture significantly improved pain severity compared with sham acupuncture at sham point. When comparing between sham acupunctures, there was no statistical significance between sham acupuncture at sham point and sham acupuncture at barium point, although the confidence interval was towards sham acupuncture at barium point. Lastly, for the treatment of cancer-related pain, a total of 7 studies were included in the network meta-analysis, and the results were similar with previous studies with chronic non-specific low back pain and knee osteoarthritis. And there were no differences between acupuncture and sham acupuncture at barium point. And however, acupuncture significantly improved pain severity compared with sham acupuncture at sham point. And also, there were no statistical significance between sham acupunctures, although the confidence interval was towards sham acupuncture at barium point. In summary, our 3 studies found that a significant difference between acupuncture and sham acupuncture at sham point. And there were no significant differences between acupuncture and sham acupuncture at barium point in 3 pain conditions. And when comparing sham acupuncture at barium point and sham acupuncture at sham point, although there were no significant differences in favor of sham acupuncture at barium point in chronic non-specific low back pain, there was no significance in knee osteoarthritis and cancer-related pain, even though the confidence interval was toward sham acupuncture at barium point. Then, what causes the different results, especially between sham acupunctures in the 3 pain conditions? First of all, it can be due to precision of the results because of the differences in the total sample size. As you can see in the table, the total sample size of 3 pain conditions were highly different. Even though there was a difference in statistical significance between 3 pain conditions, considering that the direction of the research result was the same, the precision due to sample size might affect the result. Second, it might be due to risk of bias in the included studies. However, in all studies comparing just barium and sham acupuncture in 3 pain conditions, blinding of participants and outcome assessors was successfully performed, meaning that the effect between acupuncture and sham acupuncture might not be affected by blinding. In addition, differences in diseases and other factors contributing to the effect of acupuncture might affect the result. In conclusion, the effect of sham acupuncture on pain severity was different from that of barium acupuncture, depending on whether sham acupuncture was performed at the same acupuncture points as those in the barium acupuncture. Therefore, the efficacy of acupuncture might have been underestimated in previous studies due to inaccurate point selection in sham acupuncture. As for the implications for future research, it is possible to conduct the direct comparative clinical trials between barium acupuncture, sham acupuncture at sham point, and sham acupuncture at sham point, which would confirm the accuracy of our network meta-analysis results. However, as you know, that as questions to arise as to whether sham acupuncture can be used as a real placebo, it might be more helpful to confirm there are effect differences of sham acupuncture according to the specificity of needling pain point in other conditions using network meta-analysis. And this would help elucidate mechanisms related to physiological activity of sham acupuncture, which is currently misused as a placebo control group to assess the efficacy of acupuncture. And this research was supported by Korea Institute of Oriental Medicine, our institution, and there are any conflict of interest. And our research was conducted by international collaboration project and from US, Norway, and South Korea. And I'd like to thank all contributing authors below. And also, I really thank you so much for your attention.